Georgia Health Commission's inaction amid federal cuts. Imagine a state where the most vulnerable citizens are facing a healthcare crisis of epic proportions, and the commission tasked with addressing these issues hasn't met all year. This is the shocking reality in Georgia, where the Comprehensive Commission on Healthcare, created by Governor Brian Kemp and state lawmakers in 2024, has failed to convene despite the looming threat of drastic federal spending cuts. But here's where it gets even more alarming. The chair of the commission, Kaylee Nagel, is set to release a report next week that apparently downplays the urgency of the situation, leaving many to wonder if the commission is taking the crisis seriously enough. The commission was established to tackle some of the state's most pressing healthcare challenges, including the high rate of uninsured adults, the financial struggles of rural hospitals, and the skyrocketing costs of healthcare. With the recent passage of President Trump's historic tax and spending bill, which includes massive healthcare spending cuts, the need for the commission's input has never been more critical. Yet, Nagel has cited the complexity of the congressional discussions as the reason for not convening the commission, a decision that has raised eyebrows among healthcare advocates and commission members alike. Dr. Harry Heiman, a commission member appointed by the minority leader of the Senate, has expressed his disappointment and frustration with Nagel's decision, saying it makes a mockery of the role that state lawmakers had envisioned for the commission. "I take my role in the commission seriously, and I believe that our work can protect lives," Heiman said. "But it's preposterous to publish a report on behalf of a commission that hasn't met." The report, drafted by consultants from the accounting firm E&Y, is expected to summarize the core topics that the commission identified last year as needing attention, including Medicaid access for low-income children, the need for a larger healthcare workforce, and improving access to health insurance. However, the report's lack of mention of the drastic impact of the federal spending cuts on Georgians has sparked controversy among healthcare advocates. The new law, H.R. 1, strips over $600 billion from federal safety net programs, including Medicaid and food stamps, over the next decade. This has led to warnings from national health advocacy groups that the cuts will have a disastrous impact on public health in Georgia. One issue that the report does highlight is the looming threat to Georgia's health insurance marketplace, which could lead to significant spikes in health insurance premiums in 2026 and a jump in the state's uninsured rates. With federal subsidies set to expire on December 31st, and Congress showing no signs of extending them, healthcare experts are predicting premium increases of up to 75% in Georgia. The question on everyone's mind is, what will happen to the thousands of Georgians who rely on these subsidies to afford health insurance? And this is the part that most people miss. The commission's inaction and the report's lack of urgency may have far-reaching consequences for the state's most vulnerable citizens. As the situation continues to unfold, one thing is clear: the people of Georgia deserve better. The commission's failure to meet and address these critical issues has sparked a heated debate, and we want to hear from you. Do you think the commission is taking the healthcare crisis in Georgia seriously enough? Should the state lawmakers take immediate action to address the repercussions of the federal spending cuts? Share your thoughts and opinions in the comments below. Impact of federal spending cuts on Georgia Medicaid. Imagine a scenario where a federal spending bill, hailed as a triumph by some, could plunge Georgia's Medicaid system into deeper turmoil, particularly affecting vulnerable populations like those with disabilities. This is precisely what some critics fear, as President Donald Trump's recently signed legislation could lead to drastic cuts in healthcare spending, impacting states across the nation, including Georgia. Dubbed the One Big Beautiful Bill by Trump, the legislation slashes over $1 trillion from healthcare funding over the next decade. This reduction could force states to trim or eliminate various health programs, including those crucial for individuals with disabilities. Moreover, the bill introduces work requirements for Medicaid recipients in states that expanded coverage under the Affordable Care Act, a move that could prove especially challenging for those who are already struggling. Georgia, one of 10 states that opted not to expand Medicaid, instead implemented an alternative program known as Pathways to Coverage. However, this initiative has faced widespread criticism for being both costly and ineffective. According to 2022 census data, Georgia boasts the fifth highest uninsured rate among those under 65, with 13.6% of the population, approximately 1.2 million residents, lacking health insurance. This rate surpasses the national average of 9.5%. Disability advocacy groups are particularly concerned about the potential impact of these cuts. While the bill does not explicitly target funding for disabled individuals, the reduction in overall Medicaid dollars could severely hamper states' ability to manage their programs effectively. Additionally, states are not obligated to offer home and community-based Medicaid disability waivers, which are often the first to face budget cuts. Stephanie Meredith, a disability advocate with a PhD in public health, expresses deep worry about how these cuts might affect her son Andy, who has Down syndrome. Thanks to the Now/Comp Medicaid waiver, Andy has been able to thrive in his Georgia community, but he had to wait 17 years to secure his spot on the waiting list. The Now, New Options Waiver, and Comprehensive Support Waiver programs cover essential services such as medical equipment, employment support, residential care, and day programs. It's shocking to realize that while people with disabilities are presumed to have access to Medicaid, the reality is that the program often falls short of providing the additional services they need, Meredith explains. For example, while we may secure some healthcare coverage, it doesn't include direct support providers like the ones who help Andy get to his job and engage in activities like lacrosse when his parents are working. Medicaid expansion, a key component of the Affordable Care Act, aimed to extend eligibility to adults under 65 with household incomes up to 138% of the federal poverty level, FPL. However, the Supreme Court ruled that states were not compelled to expand their programs. As a result, several southern states, including Georgia, Alabama, Florida, Kansas, Mississippi, South Carolina, Tennessee, Texas, Wyoming, and Wisconsin, have chosen not to expand their Medicaid coverage. In Georgia, the federal government would cover 90% of the costs for those eligible under expansion. To qualify for Medicaid without expansion, a citizen must meet low-income requirements and fall into specific categories such as pregnancy, childhood, advanced age, blindness, disability, or the need for nursing home care. A 2024 report by the Center for Policy and Budget Priorities highlights that 1.6 million people aged 19 to 64 are in the coverage gap, too poor to qualify for Medicaid but not eligible for subsidies in the marketplace. In Georgia alone, 192,000 people fall into this gap, with 61% being people of color. Georgia's Pathways to Coverage, launched in 2023, offers an alternative to Medicaid expansion. To qualify, applicants must be citizens or legal residents aged 19 to 64, earn less than 100% of the FPL, and complete 80 hours of work, volunteering, or education credits each month. By 2025, this income threshold equated to $15,650 for an individual or $26,650 for a family of 3. Critics argue that work requirements are ineffective and perpetuate systemic issues. Gina Azito-Thompson, a policy analyst, notes that these requirements are rooted in historical narratives that unfairly stereotype Black people's willingness to work. They often funnel individuals into low-paying jobs that do not improve their financial situations or long-term prospects. Several studies have highlighted the shortcomings of Pathways. The Georgia Budget and Policy Institute's analysis of the program's first year revealed that more than 40% of Georgia's counties had fewer than 10 enrollees despite the state's high uninsured rate. The enrollment process was described as cumbersome, with a heavy paperwork burden, leading to a backlog of 14,000 applications. Moreover, the state spent 5 times more on upgrading the online enrollment system than on healthcare benefits for enrollees. An investigation by the Current and ProPublica uncovered that despite allocating tens of millions of dollars to promote Pathways, the program's enrollment remained abysmal. An independent evaluation by Public Consulting Group, commissioned by the state but not released, indicated that Pathways had enrolled only 6,500 people, far short of projections. Trump's federal spending bill mandates that states implement similar work requirements for those who qualify for Medicaid expansion under the ACA. State Senator Kay Kirkpatrick, representing Marietta, supports getting insurance for all Georgians but questions the effectiveness of Medicaid. She believes that current efforts focus on covering able-bodied adults, while other groups like children, people with disabilities, pregnant women, and seniors are already covered. On the other hand, State Representative Lisa Campbell, representing Kennesaw, views pathways as a disaster. She argues that even if the program worked perfectly, it would still be more expensive than Medicaid expansion due to the lack of federal funding. Campbell emphasizes that the healthcare costs of uninsured individuals ultimately fall on taxpayers when they seek emergency care, the most expensive form of treatment. Campbell introduced House Bill 751 during the 2025 legislative session, proposing to add caregiving as a qualifying activity for Medicaid. This would make parents caring for their children and family members supporting disabled adults or elderly relatives eligible for coverage. Campbell believes that addressing the health needs of citizens is crucial for maintaining a robust business environment. Organizations such as the Georgia Council on Developmental Disabilities, the ARC of the United States, the National Down Syndrome Congress, the National Disability Rights Network, the Muscular Dystrophy Association, the Spina Bifida Association, and the Cystic Fibrosis Foundation have opposed the proposed cuts to Medicaid. They warn that these changes will weaken the healthcare system, reduce Medicaid funding for schools, and strain state budgets, potentially eliminating vital home and community-based waiver services. Without these services, families like Meredith's could face severe challenges. About 7,000 people are currently on the Now/Comp waiver waiting list. Meredith and her husband work 60 hours per week to support their son's care, and any reduction in Medicaid funding could force them to choose between decreasing their work hours and risking their retirement savings or losing their son's community involvement. Georgia also offers the TEFRA or Katie Beckett waiver for disabled children under 19 whose parents earn too much to qualify for Medicaid. Established in 1982 under Ronald Reagan's administration, this program provides essential coverage for high-cost healthcare and therapy needs. However, the availability of these waivers varies widely by state, creating uncertainty for families. Brittany Schweigert's son Grayson, who has tuberous sclerosis complex, epilepsy, and autism, qualified for Part B of Tennessee's Medicaid diversion program. This program offers limited financial assistance rather than direct Medicaid services. Schweigert spends nearly $2,000 per month on her family's insurance premiums, with the Katie Beckett funds covering only a fraction of their costs. The ripple effects of these spending cuts could be far-reaching. According to KFF, up to 750,000 Georgians could lose their healthcare coverage by 2034 if enhanced ACA tax credits expire. Rural hospitals and senior care facilities, which rely heavily on Medicaid funding, are at risk of closing, potentially leading to longer wait times and reduced access to care. In conclusion, while the federal spending bill aims to address certain fiscal concerns, its impact on Georgia's Medicaid system and vulnerable populations remains a cause for significant concern. The debate over work requirements, the effectiveness of alternative programs like Pathways, and the broader implications for healthcare access continue.